Against what? Immune against what? Against anything. Exactly. Against anything. Against poison, against cancer, against a virus, against bacteria, against whoever hates you. That will be against, except your wife. So this will be the globulins that is being produced by the cell. So if we have a cell that's been attacked by cancer or by poison, those things can turn around and protect. But the cell is vulnerable. A cell sitting like your skin cell. Let's take the skin. Here's the skin cell. And here I am sitting in the sun having nice tan every day. So the cell right here is getting tanned. Why? Because I don't like the color God made it, so I want it darker. Okay, so I want it tanned. Because the boyfriend like it tanned or somebody like it tanned. And you take another person who's dark, God made him black, no, he doesn't like it. Then he put bleach. He wanna get rid of that. And that is called the stupidity of the human race. To change their figures or character to please somebody else. That is come from lack of education. And that we don't know. We just not ourselves mistake. We have the mirror, not the real person. So anyway, that cell bombarded on the beach from what? The ultraviolet. Or chemicals in the air. And the ultraviolet comes in, and it comes right here, and it hits these what? Genes. And the gene changes. Rather than normal gene, it becomes a blue gene. Just a change. Become a blue gene. That blue gene, it doesn't belong to me. I'm supposed to have tan, I'm supposed to have white, but now it's blue. Well, what do the genes serve in the skin? What do they do in our skin? So when I cut myself, if I cut myself, they're supposed to realize I've been cut, and they're supposed to make cells and heal it, right? That's their job. But now, they don't see that. They have a new kind of a cell that thinks that the whole skin is being cut in pieces. So start what? Multiplying to new cells. Oh, it's being cut. Oh, we didn't realize that. It's being cut every day. And keep growing. That's called the skin cancer. You follow me? And you don't know it's happening. You don't know it's happening. Fortunately, the one we see in the face, called basal cell carcinoma, we can see any lesion that's developed on your face can be cancer. I said can be cancer. I didn't say it is cancer. It can become cancerous. So what can we do for somebody who have 20,000 pieces of them, and we're going to biopsy each piece? There will be nothing left. I have a lady come to me with skin cancer all the time. She's 78, and she said, when are you going to take my cancer, Dr. Nasr? I said, Emily, I took your cancer 10 years ago. And she said, but I do. I said, yeah, your face is full of cancer, and if I take each piece of cancer, you got no face left. So there's nothing I can do. So put some vitamin E on it or whatever you want. But we're not going to radiate the face. The woman want to enjoy life, but that's not a dangerous cancer. But you take another cancer that here it is. Rather than the gene is blue, it's turning purple. That's a purple gene. Or black gene. That's called melanoma. And that happens in where? In the skin again. Right here. There's one right here. This black thing I just put in my hand. Oh, this could be normal. It could be melanoma. Well, big deal. You know, I always had that. I had it for a year already. It's not a big deal. That's what we say, right? Wrong. Because melanoma does not spread inside the skin. Melanoma cancer cells, travels in the bloodstream underneath and goes to the liver or the brain and grows there. Doesn't grow in the same spot. Right? So that melanoma becomes what? The most dangerous type of skin cancer. Because we don't know, where it is. Now, let us say that this person in front of us, that the cells are being damaged by radiation, the skin, but it wasn't damaged by radiation. That person just ate something like cheese with sodium nitrite. I'm going to tell you a story here. I came to lecture in Wisconsin in 1971. I was the first one to be invited to speak about preventive medicine. They never heard about it. Richland, Central Wisconsin. They said, oh, this doctor comes from Egypt. He knows nutrition. We're going to have him talk. I was talking about the same thing I was talking about today. But that lecture that day was against saturated fat in dairy products, in animals. But the fat in dairy product can plug arteries and cause heart attacks. That's my theory those days before we know it now. For that saying that, I was arrested. And my citizenship was put on hold for 5 continuous years. Because this is a communist coming to us to tell us that our fat that we've been eating for all the time is bad for us. This guy, we have to get rid of him. It doesn't work. Because if you believe in helping human beings and you believe in your own message, regardless of where it is, you always win in the end. But you have to stick with it. That's what I did. I told the guy who was there, I told him, you are talking to me that there's chemicals in the milk, chemicals in that. I'm saying wrong things, and you sitting in front of me, the prosecutor. You're sitting with all the cancer eating your face right there, your hand, and then you're talking about that. I did. I told him that. I said, look at you. With cancer in your hand and your face and all the warts and everything like that. You're talking about health and nutrition? And then he said, okay, we have injunction against you that you do not leave town unless the judge otherwise issue warning of arrest. I said, I'm leaving anyway. I don't care what the judge says. I have a medical exam in the school. I have my final next day. So I left. I issued a warning, and then I wasn't arrested. My lawyer came and said, okay, forgive him for it. And the case was dropped later. You see? But that is what you want to do. Dr. Lind, a very nice gentleman in London, 1936, he told the Royal College of Physicians that those people who have bleeding gums need vitamin C. There is something in the oranges they can take. But he was from a farm area in England. He's not from the big shot, in London by the Queen. I'm glad he wasn't by the Queen. So in any way, this guy was arrested by saying vitamin C can help bleeding gums. And put in jail, and he died in jail. Dr. Schultz, who discovered vitamin E, who was driven out of the United States completely to Canada, just because say vitamin E can help against chemicals. Do you realize this thing? Just read yourself about the history of vitamins and the pioneers, what happened to them. Linus Pauling, with 2 Nobel Prizes, what happened to him? All his grants were canceled. Everything was canceled when he said vitamin C in high doses can help people. You see what I'm talking about now? But that should not prevent us to stand right here on a video camera and say those people are stupid to do that to the good people of the society. They losers, and they will lose in the end. Because these chemicals in the air, and the food, and the water, it's killing us gradually. Unless we go and fight, Union Carbide is not going to give a damn. They're not going to care. Union Carbide, when they release their cyanide gas in India, most of Americans don't care if the whole world has died as long as we are good here. You see? That is a good Christian spirit we have. That everybody dies except us. That is stupid. You should not feel that way. Listen, those people are human. And you know how many people died in that morning? Anybody followed the cyanide poisoning incident? How many people died there? Thousands. I don't remember, Al. Maybe 60,000. In my mind as a doctor, I was thinking, I said, oh, God. Here I worked so hard to save a life, worked so hard all night to save a baby, okay, and here's 60,000 gone for just little gas. As a doctor, it doesn't matter to me if he's an Indian, he's a Mexican, he's black, he's a white. God made him and he's important. And that is what we have to do. Whenever you see somebody in any part of the body, your brother, human being, being hurt from anything, you've got to express yourself, not us here only, any place in the world. In Russia, any place, we have to. In Ukraine, look what happened when terrible reaction happened. What did we do here? So the Russians, let them die. No, there were it's probably over 300 million people developed cancer from that incident. I think it's over 300 million. I think that thing is much more than we think. So these chemicals, that is the main reason of this lecture tonight, to give you two ideas. One, what's causing our cancer. Two, how to prevent it, how to protect it. Are you following me or not? This is the two messages you want to carry in your head. If you already have cancer, then you got one of them at least you can work with. These chemicals, if you analyze the human body, let's take this guy, where is he? Right here. This guy right here is me, or you. How is he protected against that? When you study the human body, you're going to find a few things interesting. There's always fat under the skin, as we know very well. And that fat under the skin is not there by accident. Fat is the best anti-cancer agent you have in your body. It's fat. Fat absorbs chemicals that causes cancer. You got that? Okay, it doesn't mean go ahead and get so big and say, well, I want to be protected against cancer, I'm going to be so big. There are limits to that. But that is one of them. Number two, look at how the skin is made. The skin is made from cells connected with what? What is the cells connected with? Collagen. And collagen is made of vitamin what? C. And number three, the keratin on the skin is there to protect the skin. You don't keep rubbing the skin every day until you get to the dermis and removing the epidermis so it looks nice. No. Be gentle on the skin because those keratin are there to protect against infection and also against radiation from outside. Inside the body, how are we protected? To understand that, you have to go back to the human cell again. This is a cell in the liver, or the lung, or the breast, or the prostate, or the ovary, or the intestine, all the places that can develop cancer. How is it protected? It's protected because if you study the human cell, it is surrounded by a layer of lipid, fat, which is made of vitamin E. Are you following me? This is true. The human cell is surrounded by vitamin E. Vitamin E is anti-what? Antioxidant. So, we are born and made to survive. We are made to survive and be strong, but we don't give our body chance. Because we think that once we eat the regular diet in the supermarket, I'm getting all I need. Do you believe that? Of course not. The Department of Agriculture said it for years. Oh, if you eat right, nothing will happen to you. But who eats right? You undergo all the time. You stop in McDonald's, you stop in Burger King, or you don't eat at all, or you go to a restaurant, or you come home. We're all busy people here. So where is the nutrition? So we decided to say we need to add supplements to the diet of the body to build the body against those chemicals. But if you want to know more about vitamin E role in protecting against cancer, you heard about beta-carotene, you heard about vitamin A, you heard about Formula 1, but you never heard me saying vitamin E. That is why I'm selecting the one you don't know the most. Because vitamin E is the most potent anti-free radical. So if you have a cancer, or if I have cancer, you can just say, I'm taking my beta-carotene and my vegetables and my carrot juice. You also have to have some vitamin what? E. And a cancer patient always has to achieve one important goal. All cancer patients. Always try to gain some weight. Always. Don't let cancer make you lose the weight. If you're fat, that's fine. Stay fat until the cancer is weakened, then will make you lose weight later on. You understand that? Don't go on a diet to lose weight when you are in cancer, because that's not very good. For two reasons. Number one, when you are trying to lose weight and get rid of the fat has chemicals, and the chemical will be released, the chemical will cause more cancer. Number two, you need those fats to protect against further cancer from coming into the body. So that is how the cell is protected. Inside the human cell, the way the cell eats, the human cell has somebody sits inside here like a Buddha with called the nucleus. And that nucleus, that guy called the DNA, every morning he wakes up about 4 o'clock in the morning. And then, if you're going to wake up at 6, he wakes up at 4. If you're going to wake up at 4, he wakes up at 2. He wakes up about 2 hours before you. I mean wake up. I'm trying to use plain English here. What do you mean wake up? Means your sleep is going to start getting interrupted 2 hours before you wake up. You start getting restless. You start getting moving more. You start getting ready to get up. What is happening here? The DNA, he gets a call from the brain, and the brain has a telephone. He called him. He said, listen, this guy is waking up at 6 o'clock going to work, and he needs to have energy. He needs to eat. The DNA will send a messenger like this with a shopping list in his hand to a doorman sits right here. That is the vitamin E. To tell him this guy's waking up, we need some food. And outside of here, what do we have? What do we have outside of the cell? Blood. Full of what? Full of nutrients. That's right. Not just nutrients. Everything is in the blood. So, the calcium goes in, magnesium, manganese, and the vitamins, and everything goes in. And then the mitochondria takes it, makes energy, makes enzymes, and the body temperature starts rising from 96.5 to 97 to 98, and you start feeling warm and wake up. But if you wake up too soon, your body temperature is still 96, 95, and you'll be chilled. You need to be covered because you're not ready yet. Are you following me or not? That's how the body works. This system was called diurnal rhythm, which is controlled by the adrenal gland every day. The food goes in, but in the food you ate, there are some chemicals the guy ate for dinner from the night before. He had some beer, he had some wine, he had some chemicals. They're all going to enter where? The cell. And they can damage where? The nucleus. And when they damage the nucleus, the nucleus starts getting disturbed and starts multiplying, and now we have 2 cells next morning rather than 1. 2 cells. What's that? Oh, did I do something wrong? Oh, I guess I did. Oh. Boy, why do I have to do these things? Okay. That's fine. Okay. Now we have 2 cells. 2 cells in the liver, 2 cells in the breast, 2 cells in the prostate, 2 cells in the colon, 2 cells in the lung, any place on the skin. You follow me? They are what? What do we call them? What kind of cell are these now? These are cancer cells developed that morning. And you don't know that. You still wake up and you go to work. And the cancer is developing in the breast or any place. But the human body is also prepared to fight cancer. Because the cancer cell, with its own nucleus, with its own chromosomes, with the blue DNA in it, remember that? That's a cancer gene, whatever we called it earlier. It doesn't look normal. And that cell swims in a big, what? Artery. There's blood around it. Every tissue of the body has blood. If you don't know that, you can find out easy. So this blood have a cell in it, sits right here. Every cell, every grain of cells in the body have a couple of cells sitting watching them all day. Like this. They're looking at them. Those called the white blood cells. You see? The white blood cell all of a sudden sees it was 1 cell yesterday and 2 cells today. And also blue. They have a little phone, and here they are. Let us say this is in the breast right here. Happens. Oh, we should use the blue for that. The cancer right there in the breast development. The white blood cell sits next to us watching. Notice something is wrong in the breast. There is something is wrong there. It has a phone in it. It's called the lymph node under the arm. To tell the lymph node under the arm, here they are, it calls it, listen, I just saw this cell, which was 1, become 2. And the color was normal, become blue. And I don't think that's normal. Doesn't belong to us. This cell got crazy, and I'm going to attack it and kill it. That cell, white blood cell, gets their brothers and sisters together, and they build a big wall around it. That's the first thing they do in the breast. So we'll go back to the breast. They build a wall around it. And you don't feel anything yet. Or you might feel a cyst or anything. You say, oh, I feel a cyst today. You know, just a little lump of anything. Maybe sore, maybe not. Then they start opening their mouth and eat it. And the cancer cell is died. But the white blood cells also, what happened to them? They die. When they die, they get calcified. And we have a small piece of calcium developed in the breast. And when we do a mammogram, we say there is calcification seen in that area. Calcification means there was something wrong here, and the body got rid of it. That's what it means. The body got rid of it. And if we start to see a calcification here and here and here and here in the breast, what does it tell you if you are the doctor and I'm the patient? It means I'm forming cancer all the time, right? And that is the time we go in and take that lump out and get rid of it. This is how cancer develops in the breast. Now, let us go, if you're the same person, not the same person, but similar person, prostate, not going to be the same person now. And the same thing happens in the prostate. Then cancer develops in the prostate, and we also have to take it out. Let us assume in the skin, we take it out. But let us assume it's in the colon. How can we take it out? You see, the breast is easy to diagnose because you feel there's something is wrong most of the time. You can do a mammogram. If you don't trust mammograms, don't trust biopsies. If you have calcification, you have lump, you have a chance of having cancer. So you need what we call close follow-up, every 3 months follow-up, not every 6-month follow-up. That's through blood tests and through, not mammograms, but through blood tests, studying the immune system, through examination, through biopsy, whatever means possible to do that. The prostate is easy to, because a man, when his prostate gets large, like a woman with the breast, he's going to feel uncomfortable. Then it's easy to take care of. The skin, you're going to see something on the face of that, right? How about the sneaky type of cancer, the pancreas, the stomach, the liver, the kidney, and the colon? What can we do? If you study how many people die from those cancers, you'll be surprised. Because in the United States, cancer incidence on the rise. From 1900 to 1992, 20 years ago, we used to have 500,000 people develop cancer. Now, we have 1.5 million people develop cancer every year. Develop cancer. We're not talking about dying. Don't use the statistic of death. Use the statistics how much cancer we're getting. They try to tell us how much we're surviving. No. We want to know, are we getting more cancer or not? We are getting more cancer every day. So these type of cancers, they are inside the body. They are sneaky. How can we find them? Very difficult. It takes a physician who insists on doing what he believes in, regardless what the patient said or what anything. If he believes that there is cancer there, he has to pursue it regardless what the patient said. If the patient said, no, I know it's cancer, I don't want you to do anything about it, then he has two choices. Declare the person incompetent legally and go to the judge and work against his wish, or just take the easy route and say, go and die. You see, a doctor can legally force a patient to get a treatment. Now, I have done it to many people. I see a guy bleeding, and he said, leave me alone, and he's drunk. Then I have to tell the nurse, I want to declare him incompetent and tie him down, and then we have to stop the bleeding. That is one way. Other way is going to say, okay, go and die on your own. These cancers right here are sneaky, but we have tests. For cancer of the colon, for example, if you have any blood in the stool, any change in your bowel habits, or any history of polyps, or any history of cancer, you're a candidate for cancer of the colon, or family history. You need examination every 6 months with blood, every year with intestinal checkup. I take questions in the end. Just to remember it, in the end, I will have some time for all the questions. What time is it now? It's about 8:12. I think we'll be talking only about an hour and 12 minutes. We'll still have another 15 minutes yet. Okay, now. Cancer of the liver, you're not going to know it. It just happened accidentally when the doctor does a liver enzyme, he noticed something. Cancer of the pancreas, you're going to have heartburn. with it. Cancer of the stomach, you're going to have a heartburn. Gosh, that's so scary. Heartburn, cancer of the stomach, yes. If you have any symptom and you're not sure it is not cancer, be sure it is not cancer. Assume the worst, hope for the best. But don't ever assume the best and wait for the worst. And you got the idea or not? When it comes to cancer, assume the worst and be sure it isn't. But don't ever assume nothing and then you're the one who's going to die. Good example on that, I had a patient, UPS guy. He comes in from Mayo Clinic, from Iowa. He had a heartburn and he had HMO insurance. And you know HMOs. HMO policy don't do anything until people die. Basically. Their business is to make money. And if they do tests, they don't make money. So they do the most necessary, just up to the limit, unless you really insist. That's all HMO is that way. It's not like Blue Cross Blue Shield. Medicare is better than HMO. Even Medicare never put patient in jeopardy. That they don't have any money. They still find money for when it's urgent. Governments always find the money for the person when they need it, but not HMO. This person, HMO doctor, told him, "You have a heartburn. Here's your antacid." 6 months later, you have check up again. You still have heartburn? Yeah, but it's helping me. The medicine is helping me. Then he gave him more. Somehow he didn't like this idea. He went to Mayo Clinic. No HMO. HMO didn't pay Mayo Clinic. So he had to spend $7,000 in Mayo Clinic. Because HMO didn't pay. It's not going to pay Mayo Clinic. Mayo Clinic, they went and find cancer of the stomach. But guess what? It's already in the liver and the bone and the lung. And he had no symptoms whatsoever except the heartburn. So Mayo Clinic said, "Well, go home and die." Then he came to me. I said, "Well, listen, that's the first thing I tell a cancer patient. Only person take your life is God, nobody else. So nobody has the right to tell you when you're going to die. So any of you have cancer or know somebody that the doctor says you're going to die 3 months or 6 months or a year, don't go back to the same person. Because nobody should tell a person when you're going to die." Are you following me? We live for hope. When you take the hope from a person, even if he doesn't have cancer, he still dies with something else. And that is a mistake. So we have to tell the people, well, listen, it's a bad cancer. It's a difficult situation I'm dealing with right here. Only God cures. Let's try this and try that and see what happens and be quiet. That's all you have to say. But for the family, we tell them a different story. We tell them this is a very serious situation. The chances are less and so on. But for the patient, we never tell them directly you're going to die. We always try because I've seen cases where cancer of the colon spread and they got cured. We've seen cases of all kinds of cancer spread. And I'm sure you heard about cases yourself. People got cured, right or wrong? So you can't really judge a person because you got it. Here's your death penalty. But the problem is he waited too long. I'll give you another example. I had a patient, his name is Mr. Skinner. The reason I say the name because I took his permission to use his name in the lecture. He's my patient from Iowa. And I check him every year, he's for physical, just general physical. And then I noticed a little lump here in the neck. I said, "How long you have that?" He said, "About 2 years." I look at my notes. I didn't see it last year. I said, "Are you sure?" He said, "Yeah, for 2 years." I said, "Okay, let us do biopsy on it." I drew a biopsy, tried to do biopsies under the skin, and I'm a good surgeon too. I couldn't catch it. That thing, every time I tried to go in, hide back and forth, I said, "Gosh, this is start sweating." I called my friend, the surgeon, who's better than me. I said, "Steve, this guy, this nodule, I cannot get it." He said, "Send him to the emergency room. Let me do it." He goes to the emergency room, and Steve is a good surgeon. He couldn't do it. He said, that's a difficult one. because there is lots of nerves in the neck and you don't want to just cut anything you see, you know. Then we took it to general surgery and we got it out. And it was cancer. Try to find out where the cancer comes from. We did test and test and test every part of the body. And then I keep insisting to the doctor, it has to be in the vocal cord. The ear, nose, and throat looks, he said, there's nothing. I said, I don't believe this guy. Go to another ear, nose, and throat. The next one looks, he said, fine. I said, no, you're wrong also. It has to be in that area. And then finally, I find a little lady doctor who just came from India. She's not, she has experience, but she is more compassionate. You know, I told her, I said, listen, I want you to look. This is the third time, but look very thoroughly. She looks in the vocal cord, she finds cancer underneath the vocal cord, but everybody missed it. And we radiated it, and he's fine. Check him every 6 months. Every 6 months. Every 6 months? For what? For cancer here, right? Then I discover one kidney doesn't look right. Then I call the nephrologist, we do biopsy, the kidney cancer. We took the kidney out, that's about 7 years ago, he's fine until today. No cancer whatsoever. So, cancer is curable, but you've got to discover it early, and you've got to take it out. If it spreads already, then you have a problem, then we have to deal with other methods of fighting cancer. How can we fight cancer? Let me see if I'm missing anything here. No, I'm doing fine. Okay. Okay, now, this is how I approach cancer patients myself. First of all, we have to have the correct diagnosis. Means, if you don't have cancer at all, and you come, and you are in the age of cancer, I'm going to look for cancer. Not in the pap smear and mammogram. We look in the blood. We look in the immune system itself. We do immune study. I do chemical study, immune study, see how good is your immune system. That's my way of detecting cancer. If I find that the immune system is good, I have a good feeling that there's no cancer going to survive in that body. You know, whatever happens, you're going to beat it. And we look further to see if there are some cancers or not. So the first thing is studying of the immune system. And also studying of the circulation. Because cancer cells do not like good circulation. Usually happen in areas that have less circulation. The prostate, the breast, the skin. But you don't see many of them in the liver. You don't see many of them in the areas that there is lots of blood. Because blood fights back. After we diagnose cancer, the first treatment, number one, is always surgery. You follow me? If we can take it out, we take it out. If we can't, then we miss one chance, we'll go to the next step, which will be radiation or chemotherapy. So here I am coming to lecture to you on nutrition and cancer, and the first thing I'm talking about surgery, chemotherapy, and radiation. Why is that? Because that's the truth. That is the truth about cancer. You attack it with your biggest guns as a doctor, weaken it with the back of your mind. Without good nutrition, the cancer is going to spread. So, regardless what the cancer is, the first thing is all right here. Number two, you have to have good nutrition when you have cancer. What is the best food you can eat for cancer? Out of all food. General food, not supplements. Vegetables. Number one has to be vegetables. Always have vegetables in your diet. Vegetables have things in it we haven't discovered yet. We have Shaklee have vitamin A, B, C. Shaklee is the finest product in the world, but it doesn't have every vitamin yet God put in vegetables. I'm sure there are vitamins we haven't discovered yet. You follow me? So don't think because you're taking some supplements, you don't need vegetables. You need them. You do need vegetables. Salad, carrots, whatever. Be like a horse. You don't see many horses walking with cancer, do you? And I raise Egyptian horses because I'm from Egypt, and I tell you, none of my horses have cancer. And they eat good alfalfa. So vegetables are number one. For the horses or for the person? Vegetables raw is better than cooked. However, there is limitation how much you can eat raw. In general, I'm giving you statistics now. In general, when I travel all over the world, from Amazon to India to Africa, to in general to study diseases and cancer and all of that, people who live on fresh vegetables have less problems than cooked vegetables. Okay? So maybe fresh vegetables have things in it that cooking destroys it. Okay? But I'm agronomist, I still don't know what it is yet. Could be enzymes, it could be vitamins, it could be something. But also cooked vegetables, it helps. So you have the salad, you have the cooked vegetables. What's the second meal, important thing with the meal, nutrition you need the most? No. Fruit comes with, not that group I'm talking about, the fruit is in it. Carbohydrates. You need lots of carbohydrates, lots of starches. Potatoes, rice, macaroni. Why? Why is that? Why do you need lots of those? Energy. A cancer patient can burn up to 7,000 calories a day sitting in bed. You see? One thing you always can beat cancer, don't let it just eat the body away. Always. I learned that through my life as a doctor. Always stay ahead of it. If the person, that guy from, by the way, Iowa, the cancer all over, he was given a month to live. This is his fourth month. He's still alive. He lost 1 pound. The guy I told you about cancer of the pancreas. I'm still pessimistic. I saw him yesterday. I sat with him. I told Mr. Woods, only God heals people, and that's my language. I don't cure nobody and all of this. And his attitude had changed, but he hadn't lost weight. But he's also on chemotherapy because they sent him home. They said no chemotherapy. I found the doctor to give him chemotherapy that's gentle for his body. So carbohydrates. Include fruits. Number 3, protein. Number 4, oil. Oil, not fat. Number 5, lots of water. Do I need to talk about good water and bad water? And everybody knows here that you need to have good water. Right? Everybody, I'm sure, everybody knows our water is polluted, and if you drink it with chemicals, you're going to have more cancer, right? Okay, so when you have cancer, if I have cancer, I will be careful what kind of water I'm going to drink and cook with, isn't it? Have you heard about synergism? Synergetic effects. You see, chemicals work under synergetic effects. Means one chemical might cause little bit weakness, another weakness, but when you put them together, they cause tremendous problem. For example, when I used to work in Cairo University in Egypt, and I used to manufacture melathion, DDT, I manufactured everything for Egypt. I even manufactured mustard gas for the army. As a chemist, whatever they want to manufacture, I made it in the lab for them. Because that's your job as a chemist. One of the things we always concentrated on that you need always to be sure that the human body in every, you took one question about nuts, right? Nuts are fine, but nuts again, it has vegetable oil, it has the protein. But the protein we're talking about right here, beans and vegetable protein. We're talking about instant protein. We're not talking about lots of fish, which you read the article in the paper. I read it on the way back here from Chicago. In the gas station, I was filling gas. I was looking at the paper. It says fish found to be polluted. Well, just discovery of the day. You know, we knew that 20 years ago. It is polluted. And water, you got to have purified water. You got to drink purified water, water that chemicals is removed by. Because chemical work on synergism. You take one chemical, and then it does very little. Another chemical makes it poison. For example, I don't know if you know anything about agriculture or not. Malathion. You heard about that. The first chemical we used to make called parathion. I don't know if you remember that. A parathion, we used to make it from gasoline, and we mix sulfur with it and certain temperature, and we have this new chemical that can kill, one drop can kill so many insects in the water in one shot. I think it was 1 to 10,000 toxicity. Means one drop can make 10,000 gallons toxic. Just by, this is a parathion, by taking the same atom and moved it little bit to the side from the para to the ortho location, and malathion, the toxicity increased, just removing it, from 10,000 to 1 million. To me, one drop will poison 1 million gallons. Just moving it. So I want you to appreciate that the chemicals we put in our environment are bombs. It's our biggest enemy in the world, not Russia, not Africa, not India. We are our biggest enemies. Because underneath our homes around here, we don't know where those dumps are. We don't know what they put in them. We don't know what's in underground water. We don't know what we're drinking. We don't know what we're eating. I'm included. Because when I'm traveling, what do I eat? I stop in the same restaurant you stop in. I eat the same vegetable. I eat the same fruit. I drink the same water. So what we're saying around here, you've got to have good water as much as you can. If you can't have good water, then drink 7-Up or Coke or Pepsi. Because their water is still going to be better than a tap water. Even I don't like any of their drinks. But it's still a better water. And you follow me or not? Because their water is made by reverse osmosis before they added the poison to it. So at least it has less poison than the one in the chlorine, which was less poison than what I'm going to drink, you know. Number 6, nutrients are vitamins. You have to add vitamins, and you know all the vitamins we talked about. And number 7, nutrients, is what? Minerals, and you know which minerals we talked about it. And number 8, fibers. You know about fibers, something about fibers, and I see a lecture right here I have given about fibers. I think it was in November, all of fibers. We talked about fibers. But for the new people, just for you only, let me talk a little bit about fiber, and I'm taking more time than I should. The intestine, the bowels, is the main source of chemicals entrance to the body, not the lungs. The intestine, what we eat. If you eat food and you have fibers in your stomach, the chances is your fiber you ate with the salad, with the vegetables, will absorb probably 90% of the chemicals and take it out before it goes in your blood. You understand that? So fiber has just more than benefit of cholesterol and triglyceride. It has also anti-toxic effects. Because fibers are hygroscopic. You know what hygroscopic means? They love water. When they take water, they expand. fiber loves water. You cannot prevent a piece of fiber from taking water. When you take fiber, they expand in your system. As a matter of fact, they expand so much that they can break a building apart. One tree next to your house can split the wall. That's how much fiber. The ancient Egyptians, I visited that in Aswan in Egypt. They have an area right there where the ancient Egyptians were making an obelisk. You know what the obelisk is? This long piece of stone they have, and they cut it and they stand it up in front, like the Washington Monument. I always wonder, how do they cut the thing so sharp? I said, they must be genius. They were genius, but in a basic way. They go to the mountain, they smoothen a big area, and they drill holes in the granite, the shape of the obelisk. They fill it with sawdust, and they fill it with water, and the sawdust, and they seal it with wax overnight. Next morning, all the sawdust expand, and they have a straight line of granite being cut, and the whole thing is being done. And they have something called the unfinished obelisk. When you go there, I don't know if any of you have been in Egypt or not, and you saw that in Aswan. You see it laying down long. They didn't finish it for a reason, but it's there, how they did it. So fibers can do the same thing in the body. They go in, you drink water, they expand, they take chemicals out of the system. So that is the second thing we do for cancer patients. Number 3, we do for cancer patients. Cancer patient does not need stress. Stress is enemy number 1 against the immune system. When your immune system gets stressed, you get weakened. Not only are you going to have cancer, you're probably going to have every disease, infection, and colds, and flus, and you name it, is going to develop. Stress, most of it is internal, from poor nutrition or chemicals, or hormone imbalance in women. Some of the stress from outside. You have to find a way to get rid of stress. And that might take a lecture by itself. The stress, if it is environmental, then you have to take care of it. Most of our stress is internal, not from other people. When you think your husband is causing the stress, you're probably the one who's causing it, not him. If you think she is causing it, you're the one, not she is the one. Because when you have so many chemicals in the body, so many imbalances, so many things, all it takes a little thing to get you blown up and upset. That is you doing it, not the environment. Are you following me or no? So I think we have to look inside before we start blaming everybody outside. But outside environments are also stressful. In the highway, in the street, and this and this. You have to learn how to relax, do biofeedback, meditate. You know, when I'm in the car, for example, I always have, study religions and listen to God words and things like that in cassettes. And to me, that's type of relaxation, not the music. I used to, when I was young, I liked music, but I find it's useless. Listening to a conversation, listening to something productive, constructive to me is much better than music. You know, be involved in the discussion, something good, not something, what we're going to do when we blow up the building or following up a baseball game or something, and you go and banging your head on the dashboard. The other way you can get rid of stress is exercise. Exercise is an excellent way. 3 times a day, 30 minutes each time. In the healthy club, you have nothing else to do. That's the best way. But when you have to work, then you do it in the morning and in the evening. And then if you don't have really the time, try to walk longer distance. Intentionally walk a longer way. Intentionally. I was talking to a lady from Egypt a couple of days ago. She just came in. She's my sister-in-law mother, and she's sick. She has some diabetes, and I was talking to her. We can get rid of the diabetes. And she said, in Egypt I felt great. Here I felt terrible. I said, why do you think you feel terrible? She said, I have no exercise. Over there, intentionally, I go to the furthest store so I can walk and walk and walk. Here, everything comes to me, and I don't like that. So exercise is very important for our body. Sleep is a good therapy for cancer patients. Good night of sleep without you sleep that you wake up fresh, not you wake up tired. That is, vacation are the worst thing you can do to get rid of stress, by the way. Don't take a vacation. Because every time I think about taking a vacation, just like couple people, they're upset with each other, they're about to divorce and kill each other. I said, you know what we need? Honey, I think we need a vacation together alone. You've got to be kidding. You're going to get two people alone, you're going to blow up, kill each other. No, what you need is to have a vacation separate from each other. That's not with each other. That is realistic. I used to go to O'Hare Airport to study stress on people when I was younger, and then I said, I see people going to the airplane so happy, coming back, all dragging, and then all look tired. I said, well, what did you do? So most of people take vacation as dancing, drinking, stress, no sleep. No. A vacation is certain time of the day that you have for yourself without anybody else. That is a vacation. Certain time, couple hours in the morning, 5 to 7, or 6 to 9, or 6 to 8, not in a movie theater or something, some place that you have less stress with, people you have less stress with, or alone. That is a vacation on a daily basis. Weekend stuff is great, but how many of us are going to have a weekend vacation? Most of the time you're more busy in the weekend than weekday. So the last thing you want to do when you have cancer is toxicity. Do not approach chemicals. Your air in the house should have air filter to get rid of the chemicals and the pollen and the dust and all the stuff that traps poison in it. The water, you should have a central water system that purifies all the water going to the house. And the food, try to select the food when you go to the supermarket that's fresh. I go to the supermarket, I do all the shopping. I don't remember ever I bought a can of anything. Why? I go, I find the tomatoes, I find this, I find the cucumber, I say, oh great, this will go with this, make a salad, this will go with this, make that. But why should I be a lazy when you enjoy preparing a meal and cooking it and having a good time? So toxicity, you have to watch the water, food, and air. And drugs. Don't depend on too much drugs. If you're a cancer patient taking too much drugs, be careful with that. Okay, now, let me check to see just if I covered everything. I think everything is covered, and if it isn't, that's all you're going to get tonight. Okay, now, in the brochure you got, everybody, you have a card. My telephone number is in it. That's my other office in Hoffman State. My office is closer, Lake Villa. But this number in Hoffman State area by O'Hare is where I have most of the time. I sit and read more, and Lake Villa I work. But over there I have fun, So I do. Yeah, I do. I just sit down and then act like a boss with the doctors and then do nothing. So in any way, I'd be glad to call. If you want to call, you leave a message for me. Tell me what time you want me to call you. What's the best time you want me to call you with my secretary, and I will get back to you. Preferably at home, not at your work. Because, work, you can't just talk freely about your problems. And if home, if that's you don't want to talk because for some personal reason, then go talk from somebody else's house. Okay. Okay, that's it for tonight, and thank you very much. We're going to take some questions right now. Okay. I will start from the very back. Yes, sir. Cyst. A cyst is a cyst in any place in the breast, for example. Okay. A breast looks like this. A cyst looks like this. It's full of fluid. That fluid in it, it can be benign fluid, it can be cancer. Most of the time when you have a cyst and you aspirate it with a needle, is the wrong thing to do. Cyst should be removed completely because sometimes the fluid is benign and the wall is cancerous. As a matter of fact, from my experience, 80% of the cysts I removed were benign, 20% of them were cancer, but 100% of fluid had no cancer in it. You know, so the fluid doesn't tell you anything. You got to remove the wall of that cyst. Now, if the cyst in other location in the pancreas, that's a difficult one. We always have to go in and get it from inside. Or if the cyst in the lung or something, it will become difficult to diagnose. Okay, any other question? Yes, ma'am.
You're talking about colon cancer. What about some of the inflammatory precursors? Are they precursors?
You know, this is a very good question. What is the precursors like? You know, somebody have lots of inflammation in the colon. Would they have cancer? This is an excellent question because I always felt chronic inflammation can lead to cancer. I always felt that. For example, the guys who does carpet layers, and they have calluses here. Lots of them develop cancers in the knees. People with psoriasis, lots of them develop cancer in that area. But that's in general. Let's go more specific now. Stomach ulcers, lots of them develop to cancer of the stomach. Crohn's disease and ulcerative colitis, lots of them can become cancerous. Inflammatory diseases, and if you have a disease called autoimmune disease, I think your question is people with autoimmune disease. In general, autoimmune disease such as rheumatoid arthritis, multiple sclerosis, and many other autoimmune diseases, Crohn's disease and ulcerative colitis, all of those people, lupus, what they have, the nucleus, when it makes the antibody, remember when I said antibody, IgA, GG, and M, they making something called ANA, anti-nuclear antibody. They making antibody against the nucleus itself. So they're making something to attack themselves. And they're busy attacking themselves, leaving the body unprotected. And that's what we call autoimmune disease. You see it in multiple sclerosis, lupus. In those diseases, what I have done with them, I stop this reaction, attacking, by using anti-inflammatory methods that's safe. And doing it that way, I have excellent results. Because once I use anti-inflammatory methods for many years, I free the immune system to do. And I have a very good case. I don't know if my patient who have Crohn's disease, I'm not going to mention name, she's pregnant right now and maybe in the room right here. She had severe Crohn's disease, was bleeding. I'm bleeding pints of blood. And we put her on that anti-inflammatory system because I was worried about cancer and all of that for about, how long has it been now? I think about 9 years. And she's doing great. We did the x-ray, no sign of disease in the colon whatsoever, small bowel, everything is fantastic. She got pregnant. When she got pregnant, the disease started acting up. Because she has to take care of the baby or she has to fight the disease. And now I have to select between the baby or the disease. Now I'm treating both. So we don't know if the treatment is going to upset the baby or not. Just one of the things we decided to keep the baby and take care of the mother at the same time. So chronic inflammation, I think, it can predispose to cancer. You're right.
So they should take fiber for any kind of inflammation, especially the intestines?
It depends. Fibers is not anti-inflammatory. Fibers can irritate irritable bowel problem. In the beginning, it's a soft diet, until the inflammation is gone with whatever we use. Sometimes we use steroids, sometimes we use antibiotics, whatever, for a year or two before we start putting them on fibers. We have to have a safe anti-inflammatory, and the safest is Decadron, in my opinion, dexamethasone, or chemotherapy methotrexate. They are the safest, I think, because I never see side effects from them if you use them right. I have patients on chemotherapy methotrexate for 10 years. She had absolutely no time for leukopenia at all, because just the smallest amount to keep her disease going. Anti-inflammatory, Shacklefly is not anti-inflammatory because you don't have drugs in it. The companies that they have anti-inflammatory in it, they are drug companies, such as Herbalife, for example. Herbalife have herbs. Herbs, they have drugs in it for pain. But I rather take a specific drug for pain rather than take a herb that I don't know what's in it. Or aloe vera. Aloe vera, the reason it works in the intestine because it has acetylsalicylic acid, which is aspirin. So the way we discover aspirin, the ancient Egyptians discovered that aloe vera is good for headache because it has aspirin. And this is how we discovered aspirin in a cactus. And then, so we can't use herbs methods. And KM, the product that comes in liquids and stuff like that, you know, it's juice. It's basically liquid, has sugar in it, and minerals and vitamins and herbs. And I don't think it is safe. But everybody makes all kind of claims, and I know my qualifications, so I know I'm right, and they are wrong if they say it is safe. Because I deal with patients, they don't deal with patients. I see people sick, I say I'm well. You know, so I have to say what I see. Any other questions? I think somebody here has a question.
We want to eat a lot of fresh vegetables. Can our bodies handle it with all the antioxidants from the vegetables, handle all the pesticides and waxes and all the things that are...
No. Can the body handle all the chemicals if we take enough antioxidants? No. There are some antioxidants more potent than any vitamin you take. For example, the guy in South America, Central America, who decided to have people drink Kool-Aid with cyanide, you know, and that's the best way to do it. If you remember that incident, everybody drank the Kool-Aid and 200 people died. I'm sure lots of them had good vitamins, you know, but certain chemicals will kill you regardless how much you take, like carbon monoxide. Poisoning will kill anybody regardless. So there are limits to what nutrition can do. If you are exposed to strong enough chemical, it will kill you regardless of the vitamins. Yes?
Are chemotherapy drugs pretty standard, or are there specific drugs that you need to watch out for with specific cancers?
No. Chemotherapy is, antibiotic is a chemotherapy. Penicillin is a chemotherapy. When we say chemotherapy, we mean any drug that's made from a chemical we use for therapy. So we consider tetracycline as a chemotherapy, methotrexate is a chemotherapy, and immunized is a chemotherapy, cytoxin is a chemotherapy. Depends which one we use for what. See, the natural therapy is vitamins. Chemotherapy are drugs. So we don't want to think just chemo is cancer. You know, we have used antibiotics for cancer therapy in the past. So chemotherapy, they are dangerous. Some of them are safer than others. But right now, chemotherapy doctors are excellent. They are cutting down the side effects. They know how to use it better. They have better drugs. They know how to localize it for the tumor. They insert it in the tumor directly, and I'm very, very pleased with the way they handle it these days. So if I have cancer, I will listen to my chemotherapist. Yes?
If you have a blood test and your sedimentation rate is
You know, I written a book about that one time when I was in America. I was trying to give a whole lecture. High citrate means inflammation. That's all it means. One thing I forgot to mention to you that we use in our office, in the blood test when we do the immune system, and we check for autoimmune disease, we check also for viruses, we check for hormones, we check for nutrition, but something else we check for that I forgot to mention, we have something called tumor markers. Tumor markers are little protein cancer cells make. We can predict cancer with about 80 to 90% accuracy way before it shows an X-ray or mammogram or anything with those things. So we don't want to underestimate their benefit because they have been helpful to my patients. I've seen about 15,000 patients through my career. I don't have a single patient died from cancer who followed the regimen from the very beginning. There are people who came in advanced stages, most of them died. But for the people like the regular people come and go, most of the time we discovered them, we took care of them. The one we didn't discover, it was little bit late, but they still got cured with other methods. So prevention does work, and it shows in my office when we work with people. I think you had a question, ma'am. Yes.
Do you yourself recommend the use of tamoxifen by breast cancer?
Yes, I do. If the estrogen receptors are positive, I use tamoxifen. If the cancer have gone to the bone, I switch to Megate, and I give both of them. And there is no problem. The only problem with it, as you know, that you block all the estrogen, then you will develop osteoporosis, then you will break your hip eventually when you're on it. So how do I counter that? Calcium doesn't help either. So how do I counter that? I try to go for a patient, like in your age, I will try to go only for 4 years of cure rather than 5 years and go on the estrogen therapy right away. I try not to push my luck further because we know tamoxifen will cause osteoporosis. If the person is younger, then we let them go to the whole 6-year course of no recurrence before we put them on estrogen again. Some doctors say never estrogen for a cancer of the breast patient. I think it's very wrong. Because if you don't take estrogen, I guarantee you in writing that the calcium is not going to be absorbed and you're going to have broken hip at the age of 75 or 80 and you're never going to be able to pin it. So you'll be in a nursing home. So that is the statistics. So why we take that route when we can be in preventive medicine, something in between? You follow me?
Well, I was on tamoxifen and I developed muscular, it wasn't deterioration of muscles, but I didn't feel that my muscle tissue was the same.
You must have been on tamoxifen more than 4 years then. No, there's something else wrong. Tamoxifen doesn't do that, I don't think.
And a surgeon at Madison said that the tamoxifen would do me more harm than good, but the oncologist...
No. The surgeon is wrong, the oncologist is right. That's for sure. Because you see, it's a scientific thing we have to work with here. We don't want to approach serious diseases like cancer, heart disease, strokes by guessing. You know, you deal with serious problems, going to kill people. If you make a mistake as a doctor, the result is the death of the patient. You see what I mean? So we have to make the right decision. The right decision is it scientifically proven that works? It is. If the estrogen receptor is positive, the tamoxifen will attack the estrogen receptor and destroys it, and the cancer most likely will not recur. It doesn't prevent it completely, but it cuts it down by about 95%, the recurrence. So I think it's a good result. I think there's somebody in the back. Yes, sir. I have been in 25 years in preventive medicine. I have been involved in I have a degree in herbs, in Cairo University. Okay, that's how you do work in the Sahara Desert, pick herbs and analyze them. So the problem with herbs, some herbs they might have glycosides or alkaloids or something like that. As long as the herb doesn't hurt the person, I'm for it. You see what I mean? I'm for it. You know, if it doesn't hurt him, if I know what I'm giving, I said that's fine, take it. Because some of the alkaloids might have some benefit. But if I have a root from Japan or China that I don't know what's in it, how they manufacture it, how they grow it, you know, back 5 years ago, Mexico, they used to import herbs from Mexico, and there was actually tanks of radiation stuff spilled next to this, and all the herbs were contaminated with radiation, and people didn't know. So what I'm saying, the rule of the thumb in medicine or medical care or healing, do no harm. If you want to help somebody, don't hurt them. You follow me? That is the rule of medicine or nutrition. If you want to help him, don't hurt him. Means the first thing we have to do, no harm. Are we sure 100% that product is not going to hurt that person? Once that question is answered, then you can do anything you want. You follow me? That is the problem I have, the data to prove the study being done, the double-blind study or FDA approval or something like that. I got to have that before I recommend herbs. There is a gentleman behind you in the dark. Yes. Anti-what? For what? No, I'm not, but I have been involved in rheumatoid arthritis for 15 years, so we have used tetracycline sometimes. Mycoplasma. No. Mycoplasma is called Mycoplasma pneumonia, and I am a good bacteriologist because I have a degree I didn't mention. I also have a degree in lab medicine because I was a director of a lab. In the VA hospital, I was the director of the lab. So Mycoplasma is a bacteria that doesn't look like this. A spirochete looks like this. Something just looks like that, we call it mycoplasma, responds to tetracycline. But you see, let us face it, if you have a rheumatoid factor positive, which is anti-nuclear antibody we're talking about earlier to somebody has a question right here, you can't think about infection anymore. Once you identified anti-nuclear antibody or autoimmune disease, you're in trouble. There's no antibiotic going to work. Are you following me? Because once your cells, your patient cells, make an antibody to their own body, forget about antibiotics. You need to stop it with more powerful. You got to be smarter than the disease. That's what I do to my patients. I got to be more smarter than the disease. I know exactly how the disease works, what direction, what organ is going to damage. The heart is going to cause this, the lung is going to cause that, the brain is going to do that. Then I got to protect this organ. I might have to give linaprazine for the heart prematurely, even before congestive heart failure. I might give some Digoxin a little bit, or I might have to do echocardiogram every 3 months to detect pericarditis or cardiac tamponade and the sudden death. Or I might have to even give the patient steroids for a short period of time. But you see, everything you do, if you don't apply the whole principle, the medical management here, if you don't apply this and this and this, you will fail. Always you fail. It doesn't matter what therapy you're dealing with. You've got to work with the patient's nutrition, psychology, and lifestyle. You've got to sit with the patient, see what's bothering them, take your time. You got to see the lifestyle, the problem in the family. You got to understand. You got to feel what's going on. You see what I mean? And when I see that the family have a teenager son and he's on drugs and the mother is every other night in jail trying to get him out, then I know what kind of a stress she's under. You see what I mean? then I had to work with that. She had rheumatoid arthritis, but I got to give her something. I'm not going to give her a gun to shoot him, but at least I will give her a tranquilizer that after she comes from jail, she can have 8 hours sleep so she can wake up as a human being. You follow me? So everyone has to be approached individually. Yes?
What about digestive problems? How does one know that they're absorbing the vitamins and nutrients from the food? And what can you do to help your digestive system feel as spicy?
This is a very good question because that's something we have discovered recently. The question is, how do I know I'm digesting and absorbing my food? You know, I started questioning that about 5 years ago because some of my patients, they're doing poorly. When I give them a vitamin intravenously or injection, they come back and say, I feel better. In the beginning, I started thinking maybe it's psychosomatic. And then I'm dealing with very intelligent patients. Most of my patients, I'm so lucky, they all know more than doctors in nutrition. They know medicine very well. And most of them, I teach them about the disease very well. They know exactly what's going on. So I think there is some degree of malabsorption in our society. I really do believe, checking some of my patients, the stress from outside causes too much acid in the stomach, causes heartburn and hiatal hernia. And if that happens, it will destroy something called cofactor of vitamin B12. Vitamin B12 cofactor. I can't go to tell you what that is. If it destroys that, then B12 doesn't get absorbed. Then no wonder when I tell the patient, take some vitamin B12 home and give yourself a shot once a week or something, they tell me, yeah, I'm feeling better. It couldn't be all psychological because 90% of them feel better. So there is some degree of malabsorption. The best way to improve absorption are the first diet we talked about, the vegetable diet. Yeah. No. Why? How can you take acidophilus with hydrochloric acid when our biggest problem in our society is too much acid? I have not seen a patient who's under stress doesn't have too much acid. Their system go. And you know, have you noticed when you're under stress, your stomach getting too much acid, heartburn? Have you ever had that? That's from acid. How can we have less acid? Actually, when you're under stress, you need more calcium. You need more anti-acid. Maybe some 6 calcium with magnesium, or a glass of protein, or 10 alfalfa, or 2 tablespoons of fiber. That would be a better approach than taking acidophilus. Acidophilus does not improve digestion. However, some patients who have bad bacteria from Crohn's disease, for example, like the lady was saying, and taking some medication that disturbs the flora, yeah, they can take some acidophilus. It really calms their intestine and restores some of the flora. Again, here, we have to know exactly what we're giving something for what. You're dealing with a different problem here. But the companies, they sell products. They tend to make each product is a magic cure for everything. Everyone writes in their brochure, well, get rid of your this with our product. Come on, you know. There is no magic in medicine. Healing, if disease takes 3 months to develop, that's what it takes, minimum 3 months to develop most of chronic diseases, it takes about 2 years to heal it. So anything you're going to take when you have sickness, disease, anything you're going to take that you're going to feel better within 2 days, it's probably either drug or psychological. Because vitamin is not going to do that. Vitamins, it takes a vitamin about 120 days to start showing signs of healing. That's how long it takes. So, see, a vitamin is a nutrient. It has to go through the liver, through the bone, through the mast cell in the bone, through the white blood cells. It goes through a cycle of, and the cycle takes 120 days. So anybody says, I took this product, I feel great, probably have a drug in it. So, because, the problem is so many people don't care about anything except making money. If you have knowledge in agriculture or herbal medicine, like herbs, like we're talking about, you can really, if you're just honest, you can make billions of dollars. Because if you study herbs, there are two kinds of herbs in the world. The uppers and the downers. The alkaloids and the glycosides. So all I have to do, I have a milk index, you know which one and which one. All you have to do, get this group right here, bite, and make it in pills. These are the uppers. Here are the downers. But you got to think, are you hurting people doing it that way? So that is why I'm trying to be careful suggesting to the herbal company that I'm behind them. And I'm not going to be behind any company, Herbalax included. I never supported Herbalax as a continuous therapy for my patients. Never did. I never will. Even Shackley Herbalax. I only supported Herbalax for constipation or people cannot have a good bowel movement. I always, for 25 years, even some of the Shackley Nasr coordinators got upset with that because they've been telling their people, hey, take 20 a day, 15 a day, and all of that, and here comes Dr. Nasr saying, no, they get mad. But the scientific truth is right, that it's herb, and I rather take 45 alfalfa and 6 tablespoons of fiber and 2 tablespoons of hot plant to get rid of constipation than take 2 Herbalax. You see? Because Herbalax is a drug, natural herb. But that's a shortcut. You want it result right away. The long one is exercise, drinking lots of water, taking more alfalfa, taking more fibers, taking more hot plant. Many people don't want to go through that. I'm going to be closing pretty soon here. It's getting to be too late. I'm going to take this later right now. Absolutely. I started using estrogen during menopause about 12 years ago. I never seen a case of cancer, and the reason behind it is because estrogen can cause cancer if you don't manage it right. Estrogen, the estrogen progesterone ratio has to be correct to prevent cancer. But if you don't take it, you'll be in trouble. But if you take too much estrogen than progesterone, that you could have cancer. If you take more progesterone than estrogen, then you can have still osteoporosis. But there is another thing right now we're doing, estrogen, progesterone, testosterone combination for women. We discover I added testosterone now to the management of women hormone imbalance. Because I found out that estrogen maintains the skin turgor and the blood pressure and prevents heart attack, prevents many problems, aging of the skin and all that. Progesterone job is maintain the feeling romantic of a woman that comes from progesterone, not from estrogen. But the testosterone job in a woman to keep the muscles being flabby. When they get flabby muscles, that testosterone prevents that from happening. And that's a new discovery we just started using it the last year. So that is the balance you have to work with to try to correct it. Once you correct it,